Well, hello guys, welcome back to my channel, Karibu Tena. In today's video, I figured it was about time that I go over my clinic bag again. I've changed jobs, I've graduated from school, I'm not a graduate nurse resident anymore, and so it's about high time that I do an updated what's in my bag that's realistic for you guys. I personally enjoy watching these videos because it gives me some ideas, but I hope that you guys enjoy it too. I don't carry a ton of stuff, but I still have 12 hours that I have to spend in the PACU, and so these are some of the things that I bring along with me. So let's take a look and see what I bring in my bag. So first off, this bag is actually just like a canvas bag that I got from Hobby Lobby. It's pretty big. It holds quite a decent amount of things, but I just like it because it feels sturdy, it's basic, and I don't know, I would just rather carry this around than lug a backpack everywhere with me. And so yeah, it's got just the front pocket in it, there's no pockets on the inside, and I actually found this in the Hobby Lobby painting section because I think you're supposed to do design on it, but I've just kept it as is. So the first thing that I have is a claw clip, because we all know how much you need to put your hair up back when you're getting dirty and taking care of patients and cleaning up bodily fluids. It can get messy, so that's the first thing that I bring with me. Next, I have my handy dandy stethoscope. I'll try to link this down below, but this is a master cardiology stethoscope that I really like. And I bought this off of Etsy, but it is like a little chain that has my name on it. It just has Maddie RN on it, and then it has some little mountains. So support local or a small business. I love this thing. I can hear so much better with it than I could in my old pink stethoscope. Next, I carry around my blue light glasses because I'm literally charting all day. You have to chart as you get your patient, and so I bring these because I use them a lot. And I'm probably not going to wear them in this video because of the glare, but these can help with headaches, and if you just have to do long hours of charting, especially at nighttime, like me, I used to be on night shift, these came in super handy. Along with the glasses, I have a pair of goggles that I bring. In the PACU unit, we have 2 isolation rooms, so we still have patients who will get surgery done even if they're isolation. Into an isolation room, these are what I take with me if it's airborne or droplet, because it covers the sides of my eyes and it doesn't fog up like the other eye goggles that we have. Next, I bring a little notepad. It says nurse on it, and so this is just to write down like if I have anything at work to do, like if I need to get some like health stream modules done, or remember to attend a certain class, or even if it's just like notes that the anesthesiologist tells me that are with regards to my patient. I carry a little notepad with me just to jot them down. Sometimes I'm even writing down my grocery list, you know, in between patients at work. And so just always good to have a notepad. Next, I always carry an extra mask just in case I need one. This one's a cute little like Christmas one. It's got snowmen and like a little reindeer on it. Next, I always bring a book with me. So I currently work 10:30 a.m. to 11 p.m. at night. I'm not always there until 11 p.m. at night because typically we'll have somebody be on call sometime around 7 or 10 p.m. for the nighttime. And you're not usually having surgeries come in unless they're emergent, or it's an inpatient who just really needs the surgery done and the surgeon's available. So most of our cases are done probably around anywhere between 5 and 9 p.m. So the last like 2 to 4 hours can be a little dull. I usually will go around and I'll stock, I'll check the code cards, I will see if there's anything I need to clean up and help around with. But in order to still get my hours in, sometimes I'm there for like 1 more hour just waiting until the on-call person comes in and there's nothing to do. So I do bring a book with me. This one is called The Gifts of Imperfection by Brene Brown. I highly suggest this, especially if you're a new graduate nurse. I really struggled as a new grad with just like my worthiness, imperfections, you're always afraid to make a mistake and things like that. So this book is really good in targeting some of those issues that I had as I started out. And another friend at my last job actually recommended it, and so thank you, Haley, for recommending this. But I am really enjoying it and definitely recommend that you guys read it too. The next thing that I bring, and I just got a new one, is a planner, and I love this one. It's really cute. It's a 2023 planner. I picked it up at Target, I think. And basically, I like planners where you can see the month calendar, but then you have a day by day and a to-do list. So this one had all of it. I want to say it was like maybe $11 or $12. I've already written in some of my call shifts for the month of February, and then that's what the monthly looks like, and then this is what the day-to-day looks like. So you've got your little like what's coming up that day, like event, but then you also have a little to-do list over here, and then you have your daily top 3 or weekly top 3, which is super helpful because sometimes I can overload myself with things to do on my off days. But if I just have a weekly top 3, knowing like this is the one that has the deadline, this is the one that's the most important, we definitely need a date night and things like that, it just helps me stay much more organized. Plus, I like something that's compact because I don't want anything big and chunky, and I'm not in school anymore, so I don't have to write in assignments. So this is the perfect size if you're like me. It has like a ruler in here if you want to get extra fancy, and then it's got cute little stickers on it too. I took out all the birthday ones, so I can actually remember when my family and friend's birthday is this year. Continuing on with the notebooks, I have this notebook. You guys have seen it in previous videos. I still have it. It has all of my rapid response, cardiovascular cheat sheets and things like that. Since then, I have started to write down what's more pertinent for PACU. So basically, this is my cheat sheet book. So as you can see, I've written down just basic things that I need to know, because when you're in the PACU, you're getting a lot of different surgery types. So you might have urology patients. You need to make sure that when they wake up, you usually give them fluids, but they can't have any caffeine because it's a bladder irritant. Some of the males will have to be able to pee before they discharge. So if I'm the one late in the evening and pre-post is closed and I'm discharging them, I need to remember that they need to be able to pee before they go home. Otherwise, we might have to cath and they might have to stay in. If someone is getting a DNC, and potentially had a miscarriage, sometimes we have to check and make sure that there aren't orders from the doctor for a medication called RhoGAM. And RhoGAM is what you give to women who are RH negative if they're going to have an RH positive baby, or miscarried one, so that the mother doesn't have side effects from that baby being RH positive. So they get the RhoGAM to prevent those symptoms from occurring. Next, I have, and I don't even wear this a lot, but if I'm going back to the OR to help, I will, and it is just a hairnet basically, but it has a little extra bunched up bit in the back for a ponytail if you have a ponytail. So this will just tie around the ponytail. I look like I work in food service when I put this on. I feel like nothing wrong with that. We love our food service people, but black just seems to go with everything. So I keep this handy in case I need to go back to the OR in the evening and help them. The next thing I have, you guys have again seen, there's a lot of people I've noticed in the PACU who don't use charts. They just pull out a piece of paper from the printer and write down things on that. And it makes sense, because if you're only with a patient for like 2 or 3 hours and they're going to discharge, you don't need to have a full SBAR sheet. You still need to report in an SBAR-like format, but you have to know every single nitty-gritty thing. So it makes sense why they don't have it, but since I brought this in, a lot of people are like, oh, I want a clipboard now. So this is the one that I use. I found this the most helpful because I actually had to give an IM injection recently, and it was in the arm, in the deltoid, and I pulled this out really quick when the patient wasn't looking, just to make sure I still know how to do it and all that good stuff. I could not find it on Amazon, so I will link down below the closest thing that I can find to it. I'm not sponsored by any of them, just so you know. The next thing I have, I got this at Five and Below actually. It was like $2, but it just keeps my cords and pens and my scissors organized. So I don't know if you can see, but it has my pens, and then it has little pockets for your like phone cords and things like that. So It just kind of keeps it all in one spot so it's not just rolling all around in the bag for me. And then last but not least, the two things I don't leave the house without are in badge and my wallet. So these are in there as well. And oh, I've got my sunglasses, a pen, and some Chick-fil-A sauce because you never know when you need Chick-fil-A sauce, of course. But that is everything that was in this bag. So I hope you guys enjoyed. Like I said, I like clinic bag videos, so hope this was helpful, especially if you're getting ready to transition from student to nurse or work in the PACU like me. So I love you guys. Thank you for watching, and I will see you in the next video. Tutu Nana.